So when a cat or a dog is not eating well, especially right at that diagnosis, but anytime through the course of treatment for cancer, it really puts them at severe risk for malnutrition, which is going to reduce their chances of having successful therapeutic treatment, whatever oncology treatment they're going through. But we also know that poor body condition, muscle loss, weight loss really do affect prognosis. So dogs and cats that are under-conditioned or have been losing weight, they really do have a poorer survival time. I'm a board-certified veterinary nutritionist, so that is my passion, is nutrition. I was a general practitioner for a while before I went back and did some studies with clinical nutrition and before I joined the Hills team. So this topic is actually very near and dear to my heart because the cancer conversation was the hardest one I ever had when I was in practice myself. Right at that diagnosis, there's usually a lot of emotion and a desire to do something, even if there's no evidence that doing anything right at that moment makes a difference. So the big concern is making a change that is appropriate and safe, but also appetite is probably the biggest thing we see at the beginning of diagnosis. We see appetite decline, weight loss, muscle loss, so trying to help reduce the chances that we're going to have some weight and muscle loss early on is really important. Prescription Diet ONC Care is a new food from Hills. It is a food that was really designed around palatability to be a very, very tasty food. It's available in canine and feline, dry and wet, and it's designed for any dog or cat who has been diagnosed with cancer, whether they're undergoing treatment or not. It's really calorically dense, really palatable, really nutrient dense, so hopefully small meals are sufficient for those pets that aren't eating very well. I learned a lot about taste science during the development of this food. We really had a team of scientists who are devoted to taste, who looked at what are the dog preferences and cat preferences as far as texture goes, flavor goes. So each of the formulas has really been designed to the specific needs of a dog or a cat to be highly, highly palatable. Primary treatment is still going to be from our oncology colleagues. They're the ones who need to, initiate that treatment plan and make those recommendations for how we're going to treat the actual cancer. What we want to do with ONC Care is support the pet that's going through that cancer, regardless of whatever treatment that they're going through. We want them to be, part of a team of their general practitioner, maybe an oncologist, but our food is really designed to support the pet that's going through that. It's not designed to treat cancer, but more to support the patient who's fighting it. The nutritional profile is, again, it's really a support diet. So it's very calorically and nutrient dense, high calorie food, but when we also actually look at the nutrient content of the food, it's also really, really digestible in all of the macronutrients, protein, fat, carbohydrate. We know that digestion and absorption can be compromised in patients with various types of cancers. It also has really high levels of essential amino acids, so greater than 180% of the AFCO minimum for all of the essential amino acids. So dogs and cats are going to make sure that they're getting all of those essential amino acids for protein maintenance. It has some L-carnitine in it to help maintain muscle mass, great levels of omega-3 fatty acids, polyunsaturated fatty acids for helping mitigate inflammation. And one of my favorite parts of the food is we've incorporated our Active Biome Plus technology, which is that blend of prebiotic fibers to help with pets that are having diarrhea or constipation, really any GI signs associated with the cancer itself or the treatment. The goal really is to make this really emotional, difficult time just a little bit easier by giving owners and primary care practitioners something to recommend, as well as our oncology partners. They've been asking for a complete and balanced diet that they can recommend for their cancer patients for a long time. So we really want to give that option to owners, so even if they can't do anything else, they can help nutritionally support their pets, whether they're going through treatment or not.